Go.
Yeah, my name is Boaz Harrison Otenyo. I am the director of TREDO. TREDO is an NGO. It's called Tanzania Rural Education and Development Organization. It's a new organization. It was registered in 2008 and started working in 2009. Now TREDO has been working in different projects. It was working with one of the alternative medicine called Homeopathy for Health in Africa, whereby we were working in a project of HIV/AIDS by using alternative medicine and to help HIV/AIDS to supplement with those that are using the ARVs. Now TREDO started by myself and other fellow colleagues. One is called Amadeus, another one Benson, and Mbacho. Now yes, and other members. Now I started this organization. I had it in my mind to start this organization because of my background, where I came from. I'm coming from Tarime, which is in the northern part of Tanzania, a place that is there's extreme poverty. And I realized that the reason why there's poverty is because of lack of education. That's why even the organization has Tanzania Rural Education. Now, I think that if they get education, either formal or informal education, then this one can be a way that can help them to get rid of their poverty. Now, I'm now working in Moshi. I'm working in the bit part of the rural area. Our office is located in Rau. Rau is in the Moshi village. We have Moshi municipality and the Moshi village. Now, it is a small village, but we've worked there with HIV/AIDS patients, and we have decided to start a daycare. Now, this is the Rau Day-Care, which we started in 2009 in November. Now, the reason why we started this daycare, because one of the major reasons we realized that children are not getting proper meals, and they are not also because their parents and their guardians, of course, especially those that are HIV positives, that these children at least they need a good meal, but parents are so poor and they can't give them at least a meal. So our main objective or aim of starting this one was to give them food. At least they are accessible to food, and food is very important for them. They are taking ARVs, some of them, or some of them are not taking ARVs, but they need good diet so that they can, at least they can have better health. So one reason was to give them food and also to give them education. So we decided to take children which are from 3 or 4 years up to 6 years, those that have not joined primary schools. So we started with many children, but out of these children, we started with there were 12 children who were HIV positive, others were orphans, and others were living in very harsh environment in extreme poverty. Now, that's our first batch, which by the end of 2010 December, they closed the school and they joined different primary schools. Now we finished the 26 children by then. During that time, we were being supported by our fellow NGO, international NGO called Homeopathy for Health in Africa. Now we got a little bit of support from them, and at least it was good. But now, when it started 2011, we have 23 children, and these 23 children, there are others who came from our previous class, and also others were newly admitted. Now, among these children, there are also 6 children still living HIV/AIDS. We have 8 which are purely orphans, and we have some single parents, and also others are also in extreme poverty. These children, they still need the same needs as the previous one. They need food. And now we still feed them. Now I'm now feeding them. Professionally, I'm a teacher. I didn't say that before. I'm a teacher. I'm a secondary teacher, teaching A level. I used to teach here in Moshi, but I've been transferred to Longido, which is in Namanga. Now, out of my salary and getting some loans, I've managed to keep this center up to where we are now with a lot of difficulties. But at least children are getting at least the meal which they used to get when we were with Homeopathy for Health in Africa. They are now not supporting us, but we are together. We hope with our fellow colleagues, friends, from a few donations from our friends, we are able to keep the children up to now. And there we have our children. Now, what I can say is that it is hard. It has been hard, but we hope that we can still make it, because it's with the aim of the Trado that we fulfill our objective. These children must get what they need. And what I can say is that because we've seen, I thought that I was going, when Homeopathy for Health in Africa left us, I thought that I was going to close the center. But I realized that the community really need us, because we are not only supporting this, because there are also that have been employed. They are employed here. We employed a teacher. Now we have one teacher and 2 cooks, but all these ones they are also women living HIV/AIDS. So if we just don't give them this little petty amount that they get, it's very important for them. So it is not just a matter of these children, but we are also supporting community, that there are others that are getting employment from this center. That's why I decided that even if I don't have a donation, I'll try to use my resources that I have, so that I can keep at least the children, which are our primary goals, and also these women, at least they get their little salary that they get from us. And community has really appreciated. We are getting good assistance and also support from our local government. They encourage us. They really appreciate what we are doing. Now, my plea on my request that I'm trying my level best, but still I can't fulfill, because these children, they really need nutritious food. And getting nutritious food out of my little salary sometimes is very hard. So giving them food, but I think it's not very much what they really need. So we are learning. It's not what they really supposed to get, I know. And also, even the women who are working with us here, they don't get good salary. They are getting little amount of salary, which are really, I know that cannot really support their lives. They are getting 80,000. It's just like, let's say, $50 or $50 per month. It's not so much worth their salary. And the cooks are getting 40,000, which is just little. They need at least a little something so that they can, because they are also living this disease. They need to eat. They need to take care of their family as well. And also, we need, because we don't have our own house, we are renting the house. We need to pay for the rent, and also we need to pay for the other bills, for the electricity bills for this place. So of course, if I could get an external support, then I hope that we are going to help the community, or help these children.
Could you talk a little bit about what it means when the children can come here for the day and it takes pressure away from the community a little bit? Like from the extended families that the children would be staying with, how having a daycare center takes pressure off of the families and off of the community when children can come here for the day and have an education and have meals provided to them.
I mean, how that one is advantage?
How is it an advantage for the community?
Yeah, of course. It is. I can say the daycares really help, because in the community we have these women. These women, they don't have a good work for which they can earn their living. Now, I can say that it's released the burden for these women, because now the children can come here. They get 2 meals. They get a good porridge, which is nutritious, and also they get food. Our class is starting a bit early at around 8 up to, then we end at around 2:30. So they also get lunch. That one is a big relief from these people, Because feeding your children twice, you only feed them now, they need to feed them once, which is in the evening, and on maybe only weekends. And we have tried that. Our main, we don't go with the routine of the normal schools here. Normal schools, they are closing schools. Ours, we extend our periods because our main objective is that these children get food. If we leave them and they go back to, if we go with the timetable of the other schools around, means that these children will just go back to and starve at home. So they must be staying longer. So that's why even we are closing very late. They only have only 2 or 3 weeks. Better they come and play rather than staying at home. Yeah. And also, now there's one problem that we are facing also, is that to make, you see, these children, they need to have a future. They are getting good care here. They're getting at least this food. But we saw last time that these children, when they left here, we took them to local primary schools here. The problem is still the same. Now they are going back to where they were. Because the school here is just, they are now going back to their parent. We don't give them assistance which we used to give them at the center. So we thought that we need to channel this pupil or these children to schools which they can continue getting the support that we used to get here.
Better schools than the public schools.
Yeah, better schools than public schools. We have schools around here which are English medium, others are boarding and others are day, but they get good meal and good education. Yeah, because you don't want to lose the future of these children. They get good, right? Because some are already affected. So what you can give them, is that they get good education so that they can live.